since we're a couple minutes past the hour, let's go ahead and get started. So with that, Kayla, I will go ahead and turn it to you. Just know that I'll be in the background.
Okay, thank you. Well,
Yes.
welcome everyone. Thank you for taking the time to join us this evening for this very important discussion. My name is Kayla Hicks, and I am a member of the Gun Violence Prevention Subcommittee for Doctors for America, and also a proud health advocate supporter member of Doctors for America. And so before we get started, Keisha will put, if it's not already in the chat, a link to learn more about the benefits of being a member of Doctors for America. And it's really important to remember there is truly strength in numbers. And if we're going to do this work, we've got to do it right and do it together. So I hope that you'll join us, and I hope that you'll click on that link and learn more about the different levels and become a member and work in this space with us together. There also, we'd like to let you know that we'll be live streaming to Facebook and making a recording on all materials available afterwards. And then there's going to just be a few quick announcements that I will put here. We don't have a lot of time, and we've got some really important conversation and two amazing people that we want to talk to and hear from, and also give you a chance to talk to. So we're going to try to do our best to get through this and make sure that everybody can get an opportunity to participate in this space. And so first portion of this is we want to make sure that everyone knows that this is a free space and it's a safe space, and we do not think that any questions are stupid, and we want to make sure you're encouraged to ask the questions that you have. And then also, when asking questions, please don't forget to use the chat box there and check in there as we are talking, because we have our wonderful Keisha that will be assisting us throughout this evening to make sure that everyone is connected and getting the information that we're sharing, and we'll have it sent out afterwards as well. So we do have DFA staff that will help share these helpful links that everyone needs. And I am sorry, I do have a dog. I was hoping that she wouldn't bark, but that is not going to happen tonight. So this is Kayla Hicks and Onyx tonight. So here we go. So one other thing I want to do, sorry, I have some notes here. So what I'd like to do is make sure that I share with you what we want you to leave with. And tonight, we hope that you will learn and leave with knowing how to identify opportunities for meaningful advocacy and around gun violence, and to choose concrete methods to advocate for gun violence reduction policies and propose patient-centric solutions for violence reduction. And so now on to our panelists. So first, we have Greg Jackson, who is a survivor of gun violence and executive director of the Community Justice Action Fund. And then we also have Dr. Joseph Sakran, who we all know as Joe, right? Our Avenger, our champion, who is also a survivor of gun violence and trauma surgeon. I'm going to start with Greg. Greg, you have many hats, and I wrote down a few, and then I realized that we would not have enough time to read them because we would be 30 minutes in. And so with that, we're going to just kind of sum it up, right? And so we know that you do coalition building, policy advising, public health expert, and nationally recognized as a gun violence prevention advocate. And so today's session is about channeling your outrage into action. Could you share with our audience how you channeled your outrage into action after being questioned by law enforcement while you're in your hospital bed and being treated like a criminal and not a victim?
Yeah. So as Kayla shared, I mean, when I was shot as an innocent bystander. And while it was late at night, I was walking home when I was shot. And the bullet that hit me hit two arteries. So I was bleeding to death when I was being transported. And so when I arrived at the hospital, before I met my nurses or doctors, I was met with 3 interrogators or investigators who interrogated me about my whereabouts, what I had been doing, where was my gun, where was the drugs, asking me these very loaded questions about the incident. Which, you know, 1 was extremely inappropriate, but 2 was risking my life because I was literally losing blood at a pretty high rate. And so I refused to to answer any more questions. And I finally got to my doctor, and he shared that I only had a matter of minutes left to live due to blood loss, and that they had to race me into surgery. And luckily, I made it through surgery. I had 6 surgeries total, 21 days in the hospital, and 6 months of recovery, which is a long time to think about what happened to me. And what also was equally frustrating is when I was shot, this was only a few days after the failed Senate vote on background checks. And so I remember watching the news and also hearing them talk about gun violence, but members of Congress dismissed this as a hot button issue or too controversial to find a compromise on. And all of that was extremely infuriating, and I knew that there was a few ways I could go about it. At first I was angry, depressed, felt like nothing's ever going to change. But what was funny? When I was sitting in the bed for months at a time, I realized nothing is going to change unless I actually change how I see things, or unless I get involved in the fight. And so I decided to kind of read as much as I could on the issue, watch as many documentaries as I could, talk to as many folks as I knew, and really start to understand why exactly we were in this place, and what was missing, frankly. And the biggest thing I noticed was what was missing was voices like mine. There weren't a lot of voices of Black and Brown people who have been impacted by gun violence, and they definitely weren't being heard at the national level. They weren't being heard in Congress or in the White House. And a lot of the solutions that I was watching on television or watching being debated didn't really apply to what I went through and what a lot of my peers went through. And so I decided to first, get involved locally in DC government, working with the mayor to help with her rapid response to violence, supporting other survivors like me. But along that journey, started to learn kind of what else can we do, what else can be implemented, and even things that I researched. The mayor entrusted me to start to experiment, frankly, and pilot some of those programs, and that is what evolved into what we have now as an office of neighborhood safety and engagement. And that was a beautiful thing. But then one of my family friends was shot and killed in Greensboro, North Carolina, in 2019. And I quickly saw a contrast between what was happening in smaller cities like Greensboro versus what was happening in larger Washington, D.C., where they have the resources to try these innovative approaches. And so that's what pushed me to go one step further, and start working at the federal level to help push policy and shift the narrative nationally so that we can have resources, if nothing else, resources to invest in programs that we know can save lives, and do it at scale, that's broader than term limits and broader than the politics locally, but something that can be sustained to help save lives, just like we look at law enforcement, just like we look at fire trucks, just like we look at the health system. We also need a violence intervention system, and that's something we hope to build. So that's a little bit about my journey so far.
Well, thank you for sharing that. And, I just, I can't apologize for other people, right? And it's just very sorry that you have to experience that. I have 3 sons myself, and I constantly worry about them. There's not a day that I can't worry about them because they look like you. And I remember when I first met you, my journey in this space, I started in 2013, right about when the gun violence prevention movement started to take shape, and you started to see the organizations come in. And when I started, there was no one around in the GVP movement, not saying that there historically has not been people working on the ground on violence prevention and gun violence prevention, but in the space that I was brought into, there was no Black women, no Black men, no one in an executive position. And I was brought in to, work on background checks and bring awareness, but I felt very alone. It was challenging because I had to carry a lot by myself, right? And just listening to your stories, I heard hundreds of them. And I'm just really thankful that today in 2022, we have so many people now that are here. And I definitely, what I heard you say is that gun violence has many faces, and racism is one of them. And so we have to remember that. It's just very important. So thank you for sharing that, Greg. And we'll talk more, as we go along. I'm going to go to our next panelist, Joe. Joe, you're also a survivor of gun violence. And I know that you've shared your story on different platforms, as Greg has. But I think it's always important to continue to tell your stories, because they're never old, right? That is something that we often forget, that we have to keep hearing these stories. And you have a long list of things that you do too. Community organizer, which I love about you is because you've always been a community organizer for people, right? Just everyone, all inclusive, and a political strategist, issue advocate. And so how has your experience shaped how you channel your outrage into action? And how do you, I joke a lot in these platforms about you all, especially you being an Avenger, right? This superhero out here. But how do you channel your outrage into action, but also continue to champion for change in the gun violence prevention movement?
Yeah, well, thanks so much, Kayla, and it's great to be here with you and the rest of the attendees, and also my friend Greg. And I really, think that Greg's points, as always, are so critical and important. And I hope we can peel back some of those layers, because, the reality is that we have to elevate all the voices, especially those that are disproportionately impacted. And I think those points that Greg mentioned have been overlooked for many years. So thank you for bringing that up, Greg. Look, I come to this conversation after being shot at the age of 17. And I'll tell you, when I was shot, I really, at that point in my life, had no idea what I wanted to do in life. And, I had a pretty severe injury. I had a paralyzed left vocal cord, which you can probably hear a little bit of my raspy voice. I had an injury to my carotid artery, which is, that big blood vessel that runs blood to your brain. And I had a ruptured trachea. And, after a prolonged recovery, what really kind of changed it, honestly, was a conversation I had with my dad. I'm the son of immigrants, a father and mother that came to this country with very little. And while they had very little, they knew that the most important thing to kind of give us, an opportunity to live that American dream was to try to make sure we got an education. But I think, Kayla, like, never in their wildest dreams would they have imagined that their son would nearly be killed at the age of 17. And I was standing, I remember this so distinctly. I was standing in the restroom. I was looking at the mirror. I had this tracheostomy tube in me still. I had these beet red scars up and down my neck. And what I didn't realize is my pops was in the corner. And I think, like any father, he saw, that look of devastation in my eyes. And he came in and he said, "Look, Joe," he said, "what happened to you was terrible. But you have two options. Number one is you can feel sorry for yourself," which I think, tough love, especially from an immigrant father, right? Or the second is you can take this horrible experience and try to turn it and make it into something that impacts the lives of other people. And, if I'm being honest, when I initially, like, that conversation inspired me so much. And I was initially inspired, obviously, to go into medicine, to become a trauma surgeon. But my goal at that time was really to try to give other people the same second chance that I was given. And then what happened is I started to go down this professional path. I started to realize that despite how good of a surgeon I think I am, despite how incredible our trauma system or our trauma center may be, the best medical treatment is prevention. And I'll tell you, this is what really got me thinking beyond the operating room, beyond the trauma center, to think about how do we really work at this intersection of what I call medicine, public health, and public policy. And I'll tell you why this resonates with me so much, because honestly, I love my job. I know you've heard me talk about how much I love my job, Kayla. But the worst part of my job is having to walk into rooms and explain to moms and dads that their child that left that morning is never coming home again. And I know we have other healthcare professionals on the call that have probably had to do the same thing. And to me, it's unacceptable. And this reality that has become far too common, I just felt like I had both the opportunity and responsibility to think beyond the bedside. And it's really what pushed me to try to really mobilize healthcare professionals and communities to really think about what I call the everyday toll of gun violence. And this goes back to, some of the stuff that Greg was mentioning. I mean, let's be honest, right? It wasn't until white suburban schools started getting shot up until people started paying attention. And I'm not saying, don't mistake me. I'm not saying those are not important events to prevent. Of course they are. But every day in cities like Baltimore, we have young brown and black men that are being killed. These are the patients that I'm having to take care of. And, the mass shootings that comprise less than 2% of this public health problem take up a significant amount of the media attention. And that doesn't even begin to get into the fact that the non-fatal injuries, right? The people that say have a flesh wound, right, come in and leave, we're not even focusing on those individuals. And guess what? 40% of them are going to come back in 5 years. So in my mind, those are missed opportunities to try to figure out how do we weigh in, right? Because this public health crisis is fueled by health inequities that exist within our communities, right? And the structural violence is grounded in the fact that communities of color are more likely to live in poor neighborhoods with underfunded public services, less economic opportunities, limited healthcare services. So we have to think about that structural piece. So what fuels me, back to your initial question, is the fact that like every time I have to talk to these parents and these loved ones, frankly, a piece of me dies. And I wake up every morning, thinking about how lucky I am to have this second chance and to know that I'm just trying to do everything I can in my power alongside so many other incredible survivors and advocates to try to prevent these injuries from happening to begin with.
That, it's just incredible to be here. It's never old. It's always new for me each time I have encounters with champions like you and Greg in this work. You have two men, two different lives with the same stories. Gun violence almost ended everything for you, and here you two are saving lives through your stories and through the work that you do. You both will always be heroes in my book, and I think that I want to continue to uplift you. I know this work could be extremely challenging. There's so much competition about how this work gets done that many times will be, and Joe, recently here when I was in DC, I was down on my luck. I was hard on myself. I've been doing community organizing for 30 plus years, and I've helped hundreds of families bury, take care of, find money I've done so much for so long. And I often get pushed back into the shadows as a Black woman. That is something that's a different conversation, but it's something I've lived with and I'm okay with, right? Because I'm doing what I'm supposed to do. But what I do know is that the challenges of this work, it's a cost to it. And listening to you and Greg talk about what you experienced, it still sounds like it just happened today, and that's impacting me. So I don't know how it's impacting you, but you both knowing the challenges that are in this space, whether it be funding, resources, human capital, the work is hard. And so one of the things that I wanted to make sure that we did, as we have you two champions here helping our audience to learn how to channel their outrage into action, is to talk about what that outrage can possibly do, or to be aware and prepared that trauma is in this space. And so I would ask if, and either one of you can go first, if you could share one or two takeaways for what the frustrations, disappointments, and sometimes hopelessness that can come out of this work. What the difficulties are in this space is not talked about enough. And so if you can give one or two takeaways that you would like for people that are interested in being a part of your stories in this work, what would you want them to know about coming into this work as far as self-care goes and understanding that that has to be a priority to survive the work?
Well, first things first, I'm not hopeless. I'm actually very encouraged right now. You know, I've been an activist in this work for a long time. And what I've noticed, it's like I'm in my bedroom too. It's like a dirty room. It's like a dirty bedroom, right? When everything's a mess and everything's just junk everywhere, yes, you can like iron or wash clothes, but anything that you start with is going to be helpful. And so someone that kind of shared this analogy to me before, they were saying when your whole room's junky, just pick up a sock. Just start with something small and eventually you'll get there. And that's kind of been my mentality with addressing gun violence, is just pick up a sock, just start small, because there's so little that's been done. Even the small changes can have a huge impact. You know, one of the first things we fought for was reversing the Dickey Amendment because we found there was no research for gun violence, right? And what the impacts of gun violence that was federally funded. And so once we broke that, we start to see, okay, we got 50 million here, 100 million here. Okay, great. Now we have research and people can start to see the issue for what it is. You know, and there was so many just small fights that we won along the way that have led to the momentum that we've built now. And there is a lot of change happening. I mean, it's almost like like a volcano of change that's happening around gun violence, and not just around hardware changes, because I think that's what one of the biggest failures of the gun violence movement is we only focus on the hardware. And I think the NRA kind of dragged us into those debates. But if we look at this as a public health crisis, there's a whole comprehensive approach that needs to happen. And we're starting to see a lot of momentum in all of those different areas. And so I guess what has helped me, as far as kind of balance and keeping your head with everything, one is setting milestones, you know, for yourself and looking at the big picture and looking at what are those small accomplishments that you can get to, recognizing that all of those add up to the ultimate change that we want to see, and chasing those moments, chasing those milestones and just chipping away. You know, for example, we were fighting to get community violence intervention funding. We had never gotten any sustainable funding in history. I think there was like one little blip of 16 million at one point. And we asked for $5 billion. The White House looked at us crazy. Congress looked at us crazy, but we said, hey, this is the real down payment that you need to address this crisis. And so we didn't go out there and just say 5 billion or bust. I mean, that was ultimately what we were trying to do. But the first thing we did is say, okay, how many senators can we get bought in? First, it was 5, then it was 8, then it was 20. And they wrote a letter in 2020, and they wrote a letter to their comrades and said, hey, CVI is an important tactic. We need resources for this. We got nothing that year, you know? And then the next year we came back and said, okay, let's build that 20. We got that 20 to 50. And then we went to the House and got the House to 140. And it was like, oh, okay, boom. And we sent 2 letters. Nothing really happened that year, you know, but we were adding up our list and we celebrated every one of those steps. And now we're at a point where the president changed executive action and opened about $12 billion in grants. We just got $250 million in the Safer Communities Act. Last fiscal year had $50 million in it. In the congressional earmarks, or the community project funding, that had $45 million in it. And so we're starting to see, it's not that we're getting one bill through, but our consistent push and us just focusing on the small milestones has created almost this avalanche of resources and buy-in into a strategy. And now we're seeing funding come from multiple sources, to the point that when anyone thinks about addressing gun violence, they have to include community violence intervention in their strategy if they want to even sound like they know what they're doing. But again, that all started with very small wins. And so I would recommend for folks, think about those small wins that can build you towards your ultimate victory. Focus on that. Don't get discouraged if your bill doesn't get passed, or the governor dismisses you, or Trump gets elected, because that's all painful moments. But what are those milestones you can reach? And then I also will say, you have to find healthy ways to cope, because in this space, you will be triggered. I'm triggered every day by gun violence. But I also have healthy coping mechanisms, whether that's running, going for a walk. I'm really big into home organizing. I'll do that if I have to. Listen to podcasts. My guy Jim Rohn talks me through it all. But you have to figure out your own systems and practices to make sure that you are at least maintaining an equal head when you're going through those emotional moments. Or at times you can leverage those even small triggers to boost you to do something more positive and constructive in your life. So those are just a few things I will share.
Yeah, I mean, look, beautifully said, Greg, and I'm going to build a little bit on some of those things. So, we've heard the term public health, crisis a number of times already tonight. I remember talking about this over 10 years ago, and people kind of look at you funny, and we published some papers on it. And I think there's a couple important points. The first is that Greg is absolutely right. This stuff does not happen overnight. Like any other complex problem that we face, there is not going to be one solution. It requires all of these different solutions, and it requires persistent effort. And the best way that I can think about this, at least historically, is if you think about the civil rights movement. And the reason the civil rights movement was so effective is because people came out every day and fought for this day in and day out. It wasn't just they came out one day and then came back a couple months later. That's what you've seen happening through organizations like Community Justice Action Fund and Brady and so many others across the country. And I'll tell you, Greg mentioned some of the changes that have recently happened, but I think there's something even bigger that we have to consider here, which is the entire country has changed. And here's what I mean, is when you look at where we were 10, 15 years ago, okay? In 2008, we had 63 democratically elected members of Congress that had an A rating with the NRA. In 2018, that number was 3, and I think it's now probably 0. The point is the temperature of the country has changed. We've shifted. So why is that? It's because it's people, that are on this call, people like you, Kayla, and Greg, and so many others that are fighting in communities every day. It's the moms that are going to the state capitals, in their shirts, right? It's all of these individuals, because most governing in America happens at the local and state level. And that community involvement is so critical. And it's allowed us to, I think, be successful finally at the federal level, because people are no longer going to stand on the sidelines of history as we have, individuals and Americans continue to be slaughtered. This did not happen overnight. This was progressive, and we continue to kind of fight one battle after the other. And I think that's such a critical piece to remember, because if you had asked us, about this maybe a month ago, Kayla, maybe we would have been a little less hopeless. But now, the recent passing of the Bipartisan Act, which I'm sure we'll probably get into, right? That's historic, even though it's just a first step and it's not everything we want to see. That is yet another step that we have taken in the right direction. And I think there's just two other points that I want to make. The first is, Greg talked about, the communities and the importance of funding. I'm going to take that to another level. I think the other piece that is so critical is elevating leaders within the community, because the people that are closest to the struggle are the ones that understand what the solutions are. And I think for far too long, we have had, scenarios where the ivory tower will come in and try to tell the community what they need. I think the real partnerships elevate those type of leaders and work with them in true partnership to be able to not just bring them the resources, but develop that trust and figure out really what they need and how to peel back some of those layers. The last piece that I just want to say is that, I think what I have seen is that there's a lot of people working in the gun violence prevention space. And I think it's gotten better than where it was, but I think for a long time, people were kind of siloed off. And what I've recently started to see is we've started to break down some of these barriers where now you have these real partnerships and these collaborations. That's what's going to make us really effective, is if we have one voice versus a bunch of people trying to do different things. If we can do that, I think it's going to really allow us to continue to move that needle forward. And the last, I guess, piece to this is that for too long, I think the burden of this problem, and frankly, many other social, justice issue problems that we face in America, those burdens have been placed on the shoulders of a few people. We all need to be part of that solution, right? We don't need to wait, and put all the burden on Greg or other individuals to try to figure out problems that disproportionately impact brown and black men, right? We should be part of that solution as well. And I think we need to do more of that. And we're starting to see that. Sorry for going on.
No, I think we're good. We're good with timing. And, Greg said not too long ago, get involved in the fight. And to hear you say keep fighting, I think it's important that people understand that, there are challenges. Certainly, Greg, not calling you hopeless, but there are so many people that are still in this movement that are hopeless because of what Joe just talked about. There are lots of groups that are doing the work that don't get recognized, and they won't get recognized because they don't have the resources and or the funding or the ability or the connections to get, what they need, the support. And so I think it's encouraging to hear both of you speak, but to also remind our audience that, this is a marathon. It's not a sprint. It's never been a sprint. It's always been a marathon. And this conversation that we're getting ready to get into in our next area is going to be a testament to that there's still a lot of work to be done. There's no celebrating. There's no party to be had. There's a lot of work that has to happen. And we want to make sure that I give you two the opportunity and some time to really just talk in this space freely about what we've seen happen and with the Supreme Court, right? And I think it would be helpful to hear what both of you are thinking about how that's impacting our communities, how it will impact us. Like, what is the biggest threat that you think is coming out of the Supreme Court striking down New York's long established authority to protect citizens by requiring them to have a license, and also to prove why, what's the purpose of, carrying a firearm? And I am a responsible gun owner. I have multiple firearms, but I also believe that I should be treated, I should have to go through a more difficult process than I do to purchase a gun and carry one. I choose to go to the range to practice weapon retention, to practice all that I need to weapon safety and all the things that, that are necessary. These are choices that I make, not that I have to. And so I think talking about what we witnessed and could see some other things coming, down the line. What is it? What do you two think about the Supreme Court's decision recently? Greg?
Honestly, I was really frustrated by it. And there was a report that in Maryland, they saw, I think, around like a 900% increase in permit applications since the ruling, which is very wild. But I will say that in so many Black and brown communities, our neighborhoods are already flooded with guns, and they're already saturated. And I've always been someone that, while I know we have to fight off the flood of firearms into our communities, there is a reality that these guns are already here. And there are more firearms in America in homes that have been purchased that are owned than there are living people in this country. And so if the presence of a firearm is our biggest fear, then we already are in that nightmare, in my opinion. But we also have always operated as community justice in a reality that the guns are already here. and that the guns are they're a risk factor to violence, but not the only risk factor, and that the presence of a gun does not equal violence in all situations. And there are still things that we can do to avoid that. And so that's why we are so adamant about pushing this public health approach to violence. And by public health approach, we mean people-centered, just like we did with the opioid crisis. And I think for too long, the gun violence movement has looked at this only from a crime or regulatory or carceral approach. And we saw what happened when we tried that with the crack epidemic, where a legal possessor of a gun is a criminal. Just like we did with the crack epidemic, the illegal possessor of crack cocaine was a criminal, but whereas the illegal possessor of opioids is a victim and someone that needs to be treated and cared for. And I think we have to kind of shift our strategy if we really want to save lives in this new reality. Well, new reality for America, but very long reality for Black and Brown communities. But we have to think about, how do we treat those who are most impacted, that are closest to the pain, that are closest to violence, that have been most traumatized to violence, so they don't feel the need to pick up a gun or take it to their car or drive it to the shop or drive it to the grocery store, or to just use it for an altercation. And that's not going to come from some new law or ban. That's going to come from real investment in people and real programs and strategies to treat those who have been traumatized. And that's something that the movement has never done well. But we know that it can be done. We've seen a public health response to COVID-19. We're living it right now. We have seen a public health response to opioids. They spend $17 billion a year on opioids, that's a low estimate. It's 17 to 55 billion a year that goes into the opioid crisis. But we don't see that same economic or fiscal investment into saving lives from gun violence. And so, as frustrated as I am about the Supreme Court ruling, I think it reinforces the urgency of a public health response, and that we think about a comprehensive approach that's more than just how do we control or manage or maintain or restrict access to firearms as a way to save lives.
Yeah, I would just say a couple things. First is, I know we have a lot of different people, on the call, and just so we're all on the same page, that if those that may not be familiar, the Supreme Court ruling essentially, ended up having a decision that created an individual right to carry a firearm for self-defense in public. And it was really unprecedented. And frankly, I think a wrong decision and an unwelcome change to centuries of practice and regulation that we've had. And this decision, I think, is also going to change how lower courts are going to analyze gun laws going forward. I think it really creates this, new test for all gun laws that are rooted in history and tradition instead of public safety. So, all of that being said, I think when you think about what does this, mean for the general public, I do think that, frankly, it's going to mean that people may be less safe. And I think that the court has, frankly, imagined a right to carry a firearm in public spaces to use for self-defense. And you can expect that there's going to be now more guns in malls, parks, grocery stores, and public areas like Greg was describing. And I think that's dangerous, and it's going to cost lives. But I think we still have the ability, right, and the power to affect the direction of our democracy and the safety of our community. I thought it was interesting that as the Supreme Court made that ruling, Congress is finally passing legislation. I mean, it's like they're going in polar opposite directions. So, from our perspective, this underscores the importance that, we are just at the beginning of trying to implement a multifaceted approach to this public health problem. And I'll just add one more thing. Again, I'm not a national security expert, but I'll tell you that gun violence in America is not just a public health problem, but it's a national security problem. And when you compare people that are coming into this country, right, they are, compared to some other countries, they're at risk of being shot increases by 1,000 times compared to some other countries. Just think about that. Can you imagine just for a second that if you had a foreign actor that was killing 100 people a day, do you think there would be no policies that are implemented to take care of that? That would have changed overnight. We haven't had the same urgency for gun violence in America. And again, I don't want to be too negative because I think, like Greg and I have been saying, we are hopeful and there's been a lot of incredible movement and we just have to keep moving forward.
I thank you both for sharing that information with us. I do think that I hope that we're able to continue this dialogue. Like, I think sometimes we have these moments where we do the teach and learns or learn and leaves, and we kind of leave it and never come back to it. But sometimes we need to be reminded of the value that's added by getting this knowledge. I was taught not just a couple of weeks ago, I was visiting in Tennessee, and Greg's point about guns are here. Well, that's true, right? So in Black communities, and me being a gun owner, we still are seen as gun users in the negative way, not hunters, sportsmen, not any of the things that you would associate with a responsible gun owner, and we truly are. And so what that does is that increases the need for many Black families to feel like they want to be armed, because it's almost like as soon as you start becoming a responsible gun owner, then you're told that you shouldn't have a gun. And there's so many conversations that are being had about that right now when it comes to gun ownership in Black communities. The best thing that we can do is make sure that we are teaching the communities about safe storage, safe usage, and the things that are necessary. Joe, you were going to say something?
Yeah, no, I was just going to say, but before we move on from the Supreme Court piece, I saw there was a question in the chat about what this means for the other states. And maybe we can just quickly answer that.
Sure.
Because, the court, they're right, like the court only addressed New York's law specifically, but there are implications for other states. In fact, there's 6 other states with similar laws that are still in place. So I think, it remains to be seen what's going to happen with those. There's also room for many other gun safety laws. So, they will need to, I think, face a whole new test of and level of analysis. I'm not a lawyer, right? So it's not my expertise, but I think there are going to be implications beyond that. So for whatever that's worth.
Well, thank you too, again, for that information. I was going to say I was in Tennessee. I was able to witness how easy it is to build a ghost gun, and also learned a lot about we can be smart and still lack the knowledge that we need for the effective change that we have to see in order for us to stop seeing gun laws versus public safety, because the gun laws are the problem for public safety, right? Like, we have to figure this out together and make sure that it's not one against the other, because this whole system has to change, and we can't wait for anyone else to change it. We have to change it. And so that brings us on to, and we, it doesn't seem like it, but we have the time that we've spent has been so well spent that it's 8:46. And so what I think we can do, if Greg and Joe, you're okay with this, is we'll move on and talk about the Bipartisan Safer Communities Act, Senate Bill 2938, which I think is really important, and give you some time to share what you two believe it means, and leave any messages that you'd like for the audience to take away. And then if we have some time, which I hope we do, have a few moments to allow for anyone that is in the audience that signed on to see you two tonight, to give them some opportunity to dialogue with you. So moving on to the Bipartisan Safer Communities Act, I'll start off with Joe. Joe, I saw we were all at the White House in celebration, but it was also a moment that was pretty difficult for so many survivors that know that there's still, there's an incline, right? We're not up on the hill. And so it was a bittersweet moment. And I'd like to give the floor to you and then to Greg, so that we can talk about safer communities.
Yeah, thanks so much, Kayla. And Greg will keep me honest. I'm going to try to see if I can remember, the majority of the stuff in there. But essentially, the bill was a comprehensive bill that included, again, a multifaceted approach. It wasn't everything, but it was an incredible start. And some of the things that included were incentivizing states for extreme risk protection order. I think there was like $750 million for that. There was the enhanced background checks for those that were under 21 years of age, right? So again, this again is so critical and gets into a lot of the stuff that's being discussed around, you know, these individuals going out and purchasing assault style weapons and so forth. There was the closure of the boyfriend loophole, right, for dating violence misdemeanors. And that is really honestly so critical when you think about intimate partner violence. When a perpetrator has a firearm, it increases the risk of death for the partner by 500%. Just think about that. And, you know, for the longest time, there was this loophole that now is finally closed. And frankly, the fact that that was in there was tremendous, because a lot of people never thought that that would make it in there. There was also a clarification of who needs to register as a gun dealer and run background checks before selling a weapon. There was investment in community violence intervention programs. There was, of course, the $15 billion of funding for youth mental health crises that are exacerbated by trauma of gun violence. So it was a variety of different things that address different pieces. And while it doesn't have everything we want, this bill, most of us, I think, believe is going to save lives. Greg, did I miss stuff in there? Or you can expand?
No, I mean, I think there's a lot in there. I'm sure we both will miss a few, but there's a huge increase in the National Suicide Hotline Network. There's a huge increase. I think it's $350 million to go to the Stop School Violence Act, which prohibits the use of those funds for anyone who holds a dangerous weapon. So it doesn't include security officers or police officers, but it's investment into programs to help those who are at risk of violence, school-based intervention programs, et cetera. And again, the community violence intervention is something really huge that we're excited about, which adds some very much needed capacity for folks who are doing violence in communities that have already been traumatized by violence. But overall, I'm actually really excited about it. This is, in my opinion, better than a lot of the bills that we've seen considered before, because it takes a comprehensive approach. It has a huge amount of resources to invest in, build up and strengthen programs that have already been put in place to address violence. And then also includes some protections that frankly would have reduced the likelihood of some of the major mass shootings that we've recently seen. So it's, you know, we're really excited about it. And I think it kind of, what members of Congress say, it socializes a lot of the ideas that we have been fighting for. And the fact that we now have a bipartisan precedent to invest in these programs, to support these programs, to resource these strategies, and also a bipartisan precedent on extending background checks and extreme risk protection orders and closing the boyfriend loophole. Like, those are all things that we weren't able to get Republican buy-in before. And now we have them on record, and not just anyone. We have Mitch McConnell and Mitt Romney, like major leaders in their party that have stood with this. And I was in the chamber when they voted, and they voted proudly. You know, this wasn't something they did and scoured away. Mitch McConnell was literally high-fiving other Republicans for doing the right thing. And I think that was really impressive. Now, of course, we could do more. But again, this was the first package of all that's been considered that actually had a comprehensive approach, that looked at the healthcare system, that looked at inner city violence. The House version didn't have anything for inner city violence, to be honest. But the Senate version had both the CVI funding and a huge emphasis on gun trafficking. And those were two major elements that we know are needed. So I was excited about it, and I'm excited on where we go with it.
Greg, I just want to build off one thing that you mentioned. I'm so glad you mentioned this. And I put the SAMHSA partner toolkit in the chat, but Greg mentioned about the 988 transition. So for those that may have not heard, on July 16th, the 10-digit suicide prevention lifeline is going to be transitioning to a 3-digit number, which is 988. I just can't even begin to stress how big of a deal this is, and I think how impactful it's going to be to try to hopefully get people the type of care and support that they need in a very timely fashion. And I'll just mention, you know, people always are wondering about the extreme risk protection orders and, why they're so important. When you think about people that die by suicide, right? When someone makes that decision, 70% of them will have the attempt within the first hour, meaning after they've made the decision to die by suicide, there's no real time to intervene. What the extreme risk protection orders do in my mind is it empowers families, loved ones, right, to be who know, right, their loved ones the best, to be able to intervene long before it gets to that stage. And again, we don't have time to get into this, but the firearm mechanism is so critical because we know that when you utilize a firearm, the fatality rate is, over 95%. So anyways, just kind of that plug-in for continuing to think about suicide, which again is a violent act against oneself. People always try to say, well, suicide's not part of it. It absolutely is part of the picture.
Mhm. Great.
Greg and Joe, thank you. This has been phenomenal. It is 8:54, gentlemen. This has been so inspiring. I was looking at the chat, and I'm not good at multitasking here on the social network stuff. I don't touch anything because I will close everything and then I'll be gone. So, but I did notice something that I wanted to point out to Greg and Joe, something that touched me. The comment that says, "This has been amazing. I'm an ER physician, had been a school shooting when younger and shot at twice. I'm all in." And I just love that I'm all in that relationship where we have all these stories that are pretty much founded from the same issue. And it's this gun violence and trauma. Most of it we probably could avoid, reduce, and prevent, right? And so knowing that we only have 5 minutes left, we're going to have to speed some things up. And so what I'd like to do is, I don't see any questions there. Am I missing anything, Keisha? If I'm missing a question, please let me know. But
I got you. So there are a couple questions that have been entered into the Q&A. The first one states, "I understand this evening the focus is on community violence versus mass shootings. What are your thoughts around reducing demand versus supply? So legislative change like background checks, assault weapons ban, others for weapon/gun."
Yeah,
So
I think
what
I
are your
kind of
thoughts?
alluded to that a little bit earlier,
Okay.
but I mean, I think the biggest thing that we've been fighting for is programs that we know work that reduce the likelihood of violence. And I think the first place to start is with victims and victim services. As Dr. Sakran said earlier, there's a 40% chance that someone who's shot will be shot again, killed, or become an offender within 5 years. So if we just do a better job at working with actual survivors beyond just the hospital care, that will go a long ways. Secondly, I think even before we get to the demand part, speaking of victims, there's a lot that the hospital system and the healthcare system needs to improve upon in order to save lives. Access to trauma centers is a huge challenge. Access to skilled trauma surgeons is a huge challenge. In DC, there's only 2 or 3 that I've heard a lot about, and the others are trying to learn from. And I could be wrong. Y'all are the experts, but considering we have over 500 people shot a year, that demand in itself is a scary thing. It's a scary workload. But I think there's a lot of changes we can do specifically in the healthcare system to make sure that access to those who are being impacted by violence matches the demand and the trauma that they're interacting with. But then also beyond that, violence intervention programs that are hospital-based or community-based, and even proactive programs like Advanced Peace or Life Camp that use healing practices or cognitive behavioral therapy practices to work with folks way before the violent incident happens. And a lot of those programs have seen great results. And so we're actually going to be, sneak peek, we're actually going to be releasing a report in August called the City Violence Prevention Index that will show you, of the top 50 cities, what types of those strategies are they implementing or have they already rolled out in their city. And so please follow us to learn more and to monitor that. But you can look after early August how your city shapes up and investing in those types of strategies to prevent violence before the gun is purchased or before the gun's even picked up.
Yeah, I mean, I think those are great points. The only thing I'll just kind of add a few minor pieces. The first is like the access piece is a huge problem. And if you think about, if you were going to put together a diagram, the way I think about this is access would be in the center, right? And then if it's a hub and spoke model, you would have access plus hate. Think about Buffalo. Access plus impulsivity, right? And the story just keeps going on and on. So the access is definitely an issue, which is why we have to continue building, off of, the legislation that we passed and, totally expand universal background checks, add things like permit to purchase, reinstate, the assault weapons ban. That's 100% right. We can't wait for those legislative actions to happen and just kind of, from a private public partnership perspective, just sit back. So healthcare systems, as Greg mentioned, have the responsibility also to create, sustain, and I think grow, programs like the hospital violence intervention program and ensure that a trauma-informed, approach to delivery of care is being done. All of those things are going to be critical. And, when you think about, I'm really interested, Greg, in seeing this index. I think one of the things, we talked about the silos of the gun violence prevention community, but cities also have been siloed, meaning, healthcare systems are not communicating clearly with public health departments, with law enforcement, with other entities, right? And if we're going to be successful, all of us need to be, part of that solution. So I think in my mind, again, I want to leave you all with the fact that I think I speak for both Greg and I, we're very hopeful in where we have gotten so far. And we think, of course, there's a lot more to do, but we want you all as part of this process, part of these solutions. And I think that's how we're going to really kind of button down this issue in a much quicker way. So I'll leave it at that.
Thank you. I unfortunately, I have to tell you, it's 9 o'clock. We have arrived at our final destination for the evening. Joe and Greg, thank you so much for your 27th hour. I would really appreciate you showing up, sharing your stories and your truth and your experiences. Greg, please be sure to make sure that you send over that report. I'm sure Doctors for America will make sure that it's shared. Joe, just keep being the champion that you are. You are our avenger, and we know that this work is going to require all of us, not some of us, all of us together have to do this work. And so with that, I'm going to just say that we wanted to share a couple reminders, and that is that DFA's YouTube channel will have this available for viewing. Please do the 2-minute survey that Keisha put in the chat, and we would love for you to join us for our next Advocacy Grand Rounds in August 11th. And we just really want to thank you all for being here. We know that we have long days, long nights, and somehow we all keep doing what Joe and Greg has said all night and what they've been doing with their lives and their experiences. And that's continuing to show up for the fight. And guess what? There's not many times that we can say goodnight and be able to feel hopeful and to be able to see the sunrise and see the hill. Well, tonight we get a chance to do that. And I say, thank you, Greg. Thank you, Joe, for giving us the hope that we need to keep moving on. And we look forward to seeing you all at the next meeting. And Keisha has provided all the links in the chat for you to get the information on joining and following up